Well, hey there, everybody. Thanks so much for joining us today for our webinar, How to Support Remote Patient Care. My name's Adam Mahmood, and I'm the Industry Lead of Healthcare here at Jamf. A brief look at our agenda for the day. We'd like to start with an overview of Jamf and an explanation of how we're here to help during the current crisis. We'll then cover a brief overview of how Apple devices are being used for remote patient care in new ways. And we'll close out with a deeper dive into a story around virtual visits at UC San Diego Health with a special guest. We'll leave some time for question and answer, and feel free to direct any of those questions in through the system during the webinar. So to start, we understand that many of our customers are facing what is arguably the largest challenge they've ever seen. And we want you to know that we are here to help and want to make our products and services more accessible to you during this time of need. For healthcare organizations, the topic of today's webinar, we have a very specific available offer. Any customer looking to set up Apple devices for the purpose of telemedicine or communication between patients and their loved ones can use our products at no cost through September of 2020. If you're looking for more information about how Jamf can help empower remote work, the remote learning process, or today's topic, remote patient care, please head over to jamf.com. Now, for those of you who aren't familiar with Jamf, we help organizations succeed with Apple. It's a mission we've been on for over 17 years, and it really stems from our belief that Apple technology is best in class and provides the best user experience out there. And so to enable it, Jamf has an offering of mobile device management that covers the entire Apple ecosystem. Whether an org is deploying Mac or iPhone or iPad or Apple TV, we have had solutions to help them. But more recently, we've expanded that Apple-focused product portfolio and have 3 distinct MDM products dependent on the need for schools, for small businesses, for enterprise organizations, and have various macOS authentication and endpoint protection solutions to round out the overall Apple offering. In healthcare, 8 of the top 10 US children's hospitals use Jamf, and 15 of the top US adult hospitals use Jamf. And if you look why, it really comes back to a couple core concepts. We can use Jamf to set or dictate the way that devices should work within your organization and set all the right settings and configurations. We can then monitor wirelessly the health of those devices and ensure that they're in compliance with your organizational standards. And if they're not, if we find a device is out of compliance, we can take action, and often an automated action to bring that device back into the fold. Now, for our users, we want device experiences to be simple and ensure that they have the apps and resources that are relevant for them and not other distractions. So for today's topic, remote patient care, there's really 3 stories we'd like to tell. First, how remote monitoring in the home can play a role. Second, how maintaining communication with friends, family, and loved one is so critical to reduce social isolation. And third, how this technology can be used in an entirely new way to bridge a provider into a patient room for a virtual visit. So for the first topic, there are a few core reasons why remote patient monitoring is critical during this time. 1, we can keep high-risk patients out of healthcare facilities. And secondarily, patients that present with COVID, that perhaps are to a state where they're not needing critical level care, could they be monitored from the home setting, thus reducing the strain on the inpatient capacity problem we know is present? So we'd like to show you a brief story of what's happening with a current remote monitoring project at UVA Health in Virginia. A partner of Jamf, Locus Health, has been working with UVA for a number of years and has developed an iPad remote monitoring product. But the point of the app is to bridge the communication gap between the hospital and the home. When a patient goes home after a visit How can we maintain their communication with the care team? So here's a brief look at the app that's in use for patients. Now, this is an example of the app being configured for a pediatric monitoring population. You can see a mother is recording the weight and other metrics for their newborn baby. But this exact same platform can be tuned to allow, again, the patients in the prior categories that I mentioned, the ability to share relevant information back with their care teams. Now, for those care teams, they can then access that patient info either through an iPhone app, as you see here, or through a web app on a desktop computer. In many of the sites, this can actually be visible right within the EMR system. Locus actually provides this as a service not only to UVA Health, but also to others. So I'm excited to share that this app is, as I mentioned, not only being kind of reskinned and reapplied to COVID monitoring and other category monitoring at UVA Health with Locus, but even other Locus customers as well. Moving on to the second topic, maintaining communication is so critical. And, a few weeks ago, we were talking about some of these same situations, really focusing on negative air pressure isolation rooms. What could we do specifically in those rooms to maintain a patient's connection to the outside world? Well, the reality is that more and more hospital rooms are becoming isolation rooms. With the reduction in visitor hours and even visiting capabilities at all, this is a time more than ever than we need to ensure that families can connect with their loved ones. I wanted to share just a brief story of what the team at Geisinger has put in place around this need. Now, Geisinger, you may have seen on some prior Jamf videos or webinars. They've long had iPad programs deployed that serve out their patient population in different ways. Here, I love this. You see a patient who is admitted to the hospital that is being brought virtually into the classroom through an iPad, interacting with their teacher, fellow students, even interacting with yet another iPad that is in the classroom. So it's just such a great way to showcase the way that this technology can bridge our worlds. A very similar type scenario where, in this case, a mother who is admitted to the hospital after having a newborn is physically separated from that newborn. And here the care team using FaceTime on an iPad to let that mom see the baby. I mean, how amazing is that? This is the type of opportunity we have to bring to patients in other scenarios, including isolation rooms. Now at Geisinger, they have iPads deployed across the campuses for patient use while admitted. And these iPads are configured with a number of different apps, resources, etc. by Jamf. Importantly, the way those devices are configured allows a patient to log into their own accounts, either in the Apple native apps like FaceTime and iMessages, or the third-party apps like Skype and others, and WhatsApp. So this is a way that through simple processes, we can ensure that a patient can maintain that communication. Now, moving on to our third topic, which is, some may say, the most acute. There is a very real problem on the front line right now around protective equipment for our healthcare providers. And there is a whole emerging school of thought that technology can be used as PPE. How could an iPad be placed into a patient room, for example? And how could it be used to virtually bring the provider into the room? And if we can accomplish this, can that help us flatten the curve for healthcare providers and, frankly, the world at large? And over the last 2 weeks, there have been some drastic changes. Here you see a quote from an article written by Health and Human Services in partnership with the Office for Civil Rights, where they are actually looking to enable the use of new telehealth workflows. So if these types of changes are happening from a government regulation perspective, and there's so much evolution so quick, and Apple devices are perhaps set up to make a difference here, I couldn't think of anyone better to invite into the conversation than Eric Boyd, the Apple infrastructure architect at UC San Diego Health. So Eric, thank you so much for joining us today. How you doing?
Great. Thank you for having me.
Of course. And we'll get in to the provider to patient workflow in a moment here. But for a moment, could you just give the audience a little background of maybe your role and what you do at UC San Diego Health?
Sure. Yeah. As we've discussed a few times, we have iPads in all of our patient rooms. We have Apple TVs in many of those rooms. We have some iPhones that we're deploying for our clinical staff to do communication back into the patient room, as well as amongst themselves to help and prioritize care for our patients, as well as taking care of all of our Apple devices for our staff, whether they're their one-to-one iPads, Macs, etc.
Now, I understand that virtual visits at UC San Diego is not a new concept. Do you want to maybe take us through the background of what you've been doing and the team has been doing over the years?
Sure. So we've been doing video visits for about 3 years. And now that it is more desirable to not be in an in-person visit with your patient and your doctor, it's started to see a real demand behind that. I think we recently announced that we've had about 800 visits in a single day. And in some cases, some of our providers are having nearly 30 visits per day with their patients. So it's really amazing how well this has grown. I think we've eclipsed the number of visits that we've had in the past 3 years now, easily within a week's period of time.
That is just amazing. And I'm pulling up here an article that the leadership team at UC San Diego Health published to the Journal of Informatics and Health in Biomedicine, where they're speaking about just the rapid changes that you've seen in video visits, specifically to your point around COVID-19 and how it's just kind of precipitated this almost overnight shift for the volume of encounters you're doing via video, which is just so cool. I'm also pulling up this other quote from Dr. Brian Clay, your CMIO. Within 72 hours of the proclamation of this national emergency, you had 300 employees trained how to deliver telemedicine and over 1,000 video visits scheduled. I mean, that is just amazing to see how fast your team has moved there. So I know that's not just you, Eric. That's a work of many, many folks. So kudos to everyone there. But if we bridge back to kind of the topic I brought up of, okay, video visits, they're not new. A doctor being able to connect with a patient when the patient's at home over video, awesome, solved. But can you tell us a little bit of kind of what this new problem statement was of, how we can try to bring this workflow into the patient room?
Yeah, so to tie it back into the previous slide you've shown, we've already been doing the patient communication back to their families via Skype and FaceTime on our inpatient bedside iPads. We also have the Angel Eye system, which is a webcam over the NICU beds. So that allows our new families to see their newborn child in a entirely different environment in real time from the comfort of their own patient room. So that's a huge benefit that we've had as well. But now we're trying to focus on the ability for our clinical staff to be able to have a televisit with a patient that's currently an inpatient. So as a way to make it easy to communicate with the patient, address concerns of that patient without having to necessarily suit up to go into that room, and be able to provide a much faster response to maybe a patient's need, or to provide information to that patient in a faster manner.
Got it. Got it. And so you and the team, as we're showing here, kind of took what you said, you took that existing set of devices that were in rooms, and you said, what would happen if we just deploy Zoom to it? And do you want to expand on that a bit and tell us about kind of the version 1 workflow that you and the team put together? This would have been what, about 10 days ago or a week ago at this point?
Yeah, about that. We had, as we mentioned, we have the iPad in the room, and normally the provider wants to take the time to go over the test results and that patient education portion with the patient, make sure that they have a complete understanding. And sometimes that can be a timely process in terms of getting screened into the facility and then suiting up and getting their PPE on and getting into the room. And so this is a quick way for them to quickly essentially call the patient and initiate a video visit with the patient utilizing Zoom. So right now, the current workflow that we're doing is the one that we were able to roll out super fast was just to deploy Zoom to all these iPads. We already have Zoom installed on all of our clinical devices and for staff devices, as it's our normal meeting solution. And so we're able to deploy a app to the iPads already. The clinician starts a new meeting, calls the patient in the patient room, and has them launch Zoom and say, hey, click the start a meeting button and then enter in the 9 or 10 digit meeting code. And then they're able to hold a video session. So it's a little bit clunky, but it would allow us to get that started right away while we work to develop and improve that solution.
Awesome. I think it's just so cool how you were able to just move quickly and get the app out there. So just to hone in on that a bit, it works, but the process required the doctor or the provider to start the Zoom meeting and then to manually get this code passed to the patient in some way. And I think you mentioned it was a phone call to the actual room and they would read the code. So that
Right.
that was kind of the sticking point, if you will, of or one of the sticking points of the early workflow, right?
Yeah, it does. It does allow for there to be some confusion where maybe the patient mishears the number or the doctor transposes the number in the readback. There's all sorts of different ways where a mistake could happen.
So, and I understand there was one other kind of challenge to that first workflow, which is if Dr. A had initiated that process, that wouldn't have allowed for Dr. B to then also do the same thing, right? Because the patient would have already joined a specific meeting with a 9-digit code.
Right, because the provider would be generating their own code for this meeting, and if another provider needed to check in with that patient, then they have to wait. Or now with a patient is having to decide which provider they need to talk to more, which is not something we ever want the patient to be making their medical decisions over the doctors.
Right, exactly. So out of that initial workflow, we really isolated together, and I'm saying we because we collaborated on this, a few different particular needs, really. And I'll bring them up here on the next slide, which was our focus of how we could try to improve this workflow. And the thought was, well, rather than having the patient have to enter a random code every single time, what if we could actually create an account for the patient? And maybe even a unique account for every single patient encounter to add security that would be sent or deployed to the device for use. And of course, once that device on the patient side is set up, how do we still keep this super simple, easy for the care providers? And with the last point we brought up, support multiple care providers making a call at the same time. So out of that, Eric, do you want to take us through the next workflow diagram we see here, which explains what I would call version 2 workflow that Jamf has helped with alongside you?
Yeah, sure. So we've talked a lot about the automated enrollment and how the iPad uses Apple's device enrollment program to provision the device into Jamf via just a couple of quick setup steps. And then we have the device enroll. We have a webhook that triggers on enrollment so that the iPad is reaching out to Jamf. Jamf reaches out via the webhook to Zoom, has Zoom create that unique ID for a new user account, and then passes that information back into Jamf as an extension attribute. Then once the attribute is there, we deploy a web clip to the tablet, which contains the quick launch meeting URL for that patient. And then now when the provider needs to communicate with that patient, rather than giving them a 10-digit code, they're just telling them, hey, go ahead and tap the Meet Now button on your iPad. Once the patient is discharged, then we go ahead and wipe the tablet as we've always done before. I think we're up to 60,000 device re-enrollments and wipes on those 700 iPads. But we're adding one new thing now, which is another webhook that reaches out to Zoom and then deletes that account that was created and then clears out those extension attributes. So now the device is ready to go, and those extension attributes are now clear for the next enrollment to create yet another brand new ID.
So Eric, if that's a kind of high level view of the workflow, do you want to take us through what this looks like on the patient device when they're getting set up the first time?
Sure. So we have the iPad set up. We customize the background of the iPad, the home screen layout, so all the apps are where we need them to be so that they're logical for the patient. And we also deploy the Zoom app as well as the bedside application. And now we're deploying a shortcut that the patient only has to click and have it auto join the next meeting. So the conference starts, there's no login for them, there's no passing a 10-digit code from the provider. And this adds the advantage that I believe Adam just mentioned, where we can now have multiple providers join this same room. And then once the meeting is over and the patient is discharged, the account is deleted at the exact same time that we're wiping that iPad.
Very cool. Very cool. Now, you did mention in this workflow, the provider is still going to generally have to make a phone call. But if I flip over to the next screen, can you just walk us through what does that provider experience look like now?
Sure. So right now, or I should say last week, the provider workflow was them just launching Zoom and creating a new meeting and calling the patient. What we're deploying this week is this new directory where the provider can go to our directory page, see the list of devices and rooms that that we have of bedside iPad in. They can then type in the room number, find that room, and simply click Meet Now. That then takes them directly as a one-click link into that patient room, which is just as easy as it is for them as it is for the patient, which drastically reduces any kind of friction to get the patient provider communicating.
Very cool. Very cool. Well, Eric, I know we've also talked about ways we can look to even enhance this type of workflow in the future. One of the still current needs is to notify the patient when it's time to join. And although we've really simplified it in what you just went through, that's one concept is how could we find a new way to get the patient logged fully into this new background account that's set up on their behalf? And if they are logged in, how could that maybe enable in-app notifications to make a more kind of native experience of the provider simply just initiating the meeting or making the call? Admittedly, these are rapidly evolving workflows that have emerged, like I said previously, in the last month or so. So I really would expect a lot of these platforms that serve video conferencing to quickly start to adapt. But beyond some of the enhancements, Eric, do you want to share with the audience what the plan is moving forward with the workflow we showed and the iPads that you have today?
Yeah, as I mentioned, we're looking to deploy the solution that we just demoed this week. We're also looking forward to working with our providers of video conferencing software. And we're really hoping to see a ability to use the managed app config to deploy those accounts directly to the devices. And then if we have the patients actually logged into Zoom or logged into their telemedicine app of choice, whether that's be WebEx or Zoom or whatever flavor we want to use, then we can actually have the provider click a button in that directory, which would then initiate a call to the patient's iPad, which would make it act more like a phone and a way for them to answer the device directly, eliminating the need for there to be a lookup by the provider for that patient's phone number, and also eliminating the need for the patient to now juggle the phone and the tablet at the same time. So it would really streamline that process.
Super cool. But you did say at the beginning of there you're planning to move forward with these iPads for video visits. Do you have any more about what the plans are?
Yeah, so we're planning to deploy once we're just waiting to make sure we get the communication out to our providers so that they know how to utilize this tool effectively. But as far as the iPads are ready to go, like I mentioned, we already have the Zoom app already installed. We already have the web clip ready to go. It's just a matter of scoping it to all of our devices. And we also have configured in advance the home screen layout so that the web clip that we're providing with that one tap meeting link is already in the center of their dock. So they'll have quick and easy access to it.
Well, I love it, Eric. It's such a cool example of folks like yourself in healthcare IT innovating rapidly to support the front line. And I think this quote from your Chief Medical Information Officer, Dr. Brian Clay, really summarizes that spirit of technology-based tools and how effectively they can support institutions during a pandemic. By facilitating many different things, but cutting to the chase here, offering telemedicine visits for patients. And I'm just so excited to see the way you're taking that telemedicine concept and bringing it here to the inpatient. So thank you for what you and others are doing in this really important effort, Eric.
Well, it's great to work with such a great team at UC San Diego Health. We've really been able to rapidly pull everybody together. There's been a lot of folks who are responsible for training our staff, a lot of folks responsible for getting the iPads configured and passed out to folks as necessary. So, we're really kind of enjoying the fact that we've got a great team.
Thank you for what you're doing. So to summarize, there's really 3 areas around remote patient care that Jamf is here to help with. 1, how we can enable provider to patient room video calls. 2, how we can ensure patients maintain communication with their family and loved ones. And 3, how remote at-home monitoring can become a new area that we can leverage in the response to COVID-19. All right, thanks so much, everyone. Lastly, check out jamf.it/telehealth for some more information, and thank you so much for joining.